I want to tell you about Richard. His wife, Helen, was 72, retired music teacher, remembered every student she'd ever taught, their birthdays, their struggles, the colleges they went to. Then she started disappearing. First, standing in rooms not knowing why she'd walked in, then missing turns on roads she'd driven for 30 years. Then one evening, Helen looked across the dinner table at the man she'd been married to for 44 years and asked him when her husband was coming home. Richard had already called 3 memory care facilities, had the paperwork. 3 neurologists told him the same thing: early Alzheimer's, start preparing. Then I looked at Helen's medication list. Helen didn't have Alzheimer's. Helen had a medicine cabinet. When we made careful, supervised changes to her medications, within 5 months she was back, recognized her neighbors, sat down at her piano, remembered Richard's birthday without being reminded. This is not rare. This is happening to people you love right now. I'm Dr. Sarah Clarke. Today, I'm walking you through the 9 most common medications quietly erasing memory after 60, and the free tool the medical system has no incentive to hand you. Stay through number 1. It will change how you look at every pill in your house. Right now, before we start, drop a comment below. Are you over 60? What medications are you currently taking? I personally read these comments. Your situation might be exactly what someone else watching this needs to hear. Number 9, diphenhydramine. That little Benadryl in your nightstand? $3, over the counter. Feels harmless as warm milk. Here's what it's doing to your brain after 60. Diphenhydramine is an anticholinergic. Write that word down. It appears throughout this list, and it is the most important word in senior brain health nobody is saying out loud. Anticholinergics block acetylcholine, your brain's primary messenger for memory and learning. Think of acetylcholine as the wiring that keeps your memory lit. After 60, that system is already running lean. Diphenhydramine walks through your brain every night and quietly unscrews the bulbs, one by one. A study in the Journal of the American Geriatric Society found regular users showed measurable physical shrinkage in memory-related brain regions on neuroimaging scans. Hidden danger. It's in anything labeled PM, nighttime relief, or sleep formula. Tylenol PM, Advil PM, ZzzQuil, all of them. Switch to loratadine or cetirizine for allergies. Neither penetrates the blood-brain barrier the same way. Number 8, proton pump inhibitors. You've been taking an acid reflux pill every morning for years. Has anyone ever suggested you try to stop? PPIs, omeprazole, pantoprazole, were designed for 8 to 12 weeks. Millions of seniors have been on them indefinitely with no exit conversation. Your stomach acid isn't just digesting food, it's absorbing vitamin B12, structurally essential for brain health. Deficiency produces cognitive decline so similar to Alzheimer's that experienced neurologists routinely confuse the two. A 2016 study in JAMA Neurology, 73,000 adults over 75 found long-term PPI users had a 44% higher dementia risk. Research also shows PPIs may directly accelerate amyloid beta plaque buildup, the defining feature of Alzheimer's disease. Type PPI in the comments if you take one of these daily. I want to see how many of you this is affecting. Ask your doctor about tapering with famotidine as a bridge. If you stay on PPIs long-term, demand regular B12 testing, non-negotiable. If you're still with me and finding this valuable, type 8 in the comments right now. It tells me you're watching, and it helps more people find this information. Number 7, bladder medications. Oxybutynin for overactive bladder. Your doctor said it was appropriate. You trusted that. What almost nobody explains, oxybutynin is one of the most potently anticholinergic medications in clinical use. It doesn't stay in your bladder. It crosses the blood-brain barrier and hits the same acetylcholine system running your memory. If Benadryl unscrews bulbs, oxybutynin goes straight to the fuse box. The hippocampus, your brain's memory center, shows measurable physical volume reduction in long-term users, not fog, actual structural brain tissue loss. A 2019 British Medical Journal study, seniors on oxybutynin for more than 1 year had a 49% higher dementia risk, nearly 1 in 2. And the early symptoms, forgetting appointments, losing words, misplacing things, get blamed on aging. The medication is never questioned. Ask about mirabegron. Different mechanism entirely, dramatically less cognitive risk. Number 6, benzodiazepines. Xanax, Valium, Ativan, Klonopin. They helped millions through severe anxiety and sleeplessness. I'm not dismissing that. But hear the science. Benzos amplify GABA, your brain's calm-down signal. Effective short-term. The problem is what happens when that switch stays on for years. A 2022 study tracking 8,000 seniors over 6 years, those using benzos for more than 3 months, had a 51% increased Alzheimer's risk. Long-acting formulations accumulate in brain tissue over time. The biology. Chronic GABA amplification causes the brain to reduce its own natural activity in response. Neuroplasticity deteriorates, memory encoding slows, and when you try to stop, withdrawal is brutal. The drug creates the dependency that makes it feel necessary, even as it causes the damage. Never stop benzodiazepines abruptly. Medically dangerous. Work with your physician on a slow, supervised taper. Alternatives: buspirone for anxiety, CBTI therapy for insomnia. Number 5, statins. Statins save lives. I am not telling you to stop yours. I'm telling you something your cardiologist may never have said. Your brain is nearly 60% fat. Cholesterol inside your skull is structural. It forms the myelin sheath insulating your nerve fibers, essential to synapse formation. Without adequate cholesterol, neurons can't communicate efficiently. The FDA updated statin labeling in 2012 to include memory loss warnings after reviewing thousands of patient adverse event reports. A 2023 analysis in Frontiers in Aging Neuroscience found seniors over 70 on high-dose statins for 3+ years showed measurable increases in mild cognitive impairment. Here's what changes everything. Not all statins carry equal cognitive risk. Lipophilic statins, simstatin, atorvastatin cross the blood-brain barrier more readily. Hydrophilic statins, pravastatin, rosuvastatin, show significantly less cognitive impact. Same cardiovascular protection, dramatically different brain profile. If someone you love takes statins, share this video right now. This distinction is one of the most important things most patients are never told. Number 4, amitriptyline. Most people taking amitriptyline have no idea it's an antidepressant. It's prescribed for nerve pain, migraines, fibromyalgia, insomnia. Doctors choose it because sedation is a side effect, using the side effect as the treatment. It is also one of the most potently anticholinergic medications still in widespread use. higher receptor affinity than many drugs specifically designed as bladder medications or antihistamines. Benadryl unscrews bulbs, oxybutynin hits the fuse box, amitriptyline rewires the entire house slowly, invisibly over years. A 2015 JAMA Internal Medicine study, 3,400 adults over 65 tracked for 10 years, found high cumulative anticholinergic exposure with amitriptyline among the top contributors was associated with a 54% greater dementia risk. Even low, steady doses over years created significant cumulative burden. Ask about duloxetine or gabapentin for nerve pain, sertraline for mood. Both carry far less anticholinergic burden. Number 3. Antipsychotics. This one I need you to hear clearly. Antipsychotic medications were developed for schizophrenia and bipolar psychosis. Powerful, brain-altering drugs. Today, they are routinely prescribed to elderly patients who are simply confused, restless, or agitated, not because they have psychosis, because they are inconvenient. There is a word for sedating a vulnerable person against their own interest for someone else's convenience, and it is not medicine. The FDA issued a black box warning over a decade ago, citing increased risk of death in elderly dementia patients given antipsychotics. The prescriptions continue. These drugs suppress dopamine, linked to motivation, memory consolidation, and executive function. Chronic suppression in an aging brain accelerates neurodegeneration. A 2022 Lancet Healthy Longevity study, 25,000 older adults, found seniors given antipsychotics for behavioral symptoms were 71% more likely to experience cognitive decline within 12 months, even with no prior dementia diagnosis. If a loved one in a care facility is on quetiapine or risperidone for behavioral reasons, ask in writing, why is this prescribed? What is the plan to stop? What non-pharmaceutical interventions have been tried? You are legally entitled to those answers. Number 2. Paroxetine, Paxil. Paroxetine is an SSRI, same family as Zoloft and Lexapro. Most SSRIs are relatively safe for aging brains. Paroxetine is the exception hiding inside that category. Unlike every other SSRI, paroxetine carries significant anticholinergic activity. While Zoloft and Lexapro leave acetylcholine largely undisturbed, Paxil attacks it the way old tricyclic antidepressants did decades ago. A 2021 Frontiers in Psychiatry review found elderly patients on paroxetine showed measurable memory and verbal recall declines within the first year, not seen in patients on other SSRIs at comparable doses. The American Geriatric Society placed paroxetine on the official Beers criteria, medications considered potentially inappropriate for older adults, specifically for this reason. It is most commonly prescribed to older adults for anxiety and depression, exactly the population most at risk. Simple fix. Ask your physician whether sertraline or escitalopram offer equivalent benefit without the anticholinergic burden. Number 1. The tool they never give you. Every drug on this list, taken alone, might produce only mild effects. A little fog, a little forgetfulness, easy to blame on age. Here's the reality. The average American over 65 takes 4 or more medications daily. Many take 6, 8, 10, prescribed by multiple physicians with no visibility into each other's prescriptions. When several carry anticholinergic properties, they don't add together. Research suggests they multiply each other's effect. A 2022 age and aging analysis, 280,000 older adults, found those with the highest anticholinergic burden had a 120% increased dementia risk over 10 years. Double. From pills each prescriber considered individually safe. Now, the tool the system has no incentive to hand you. It's called the Anticholinergic Cognitive Burden Scale, the ACB scale. Doctors use it internally. Researchers use it in studies. It assigns a numerical score to hundreds of medications. It is free, publicly available, and almost no patient has ever been shown it. Search ACB scale medication list. Score every pill you take. Add the numbers. A total score of 3 or above is clinically linked to measurable cognitive impairment. This is Helen's picture. PPI every morning, Benadryl PM every night, oxybutynin for bladder, amitriptyline for nerve pain. 3 of 4 anticholinergic. Combined score in the danger range. Not one prescriber did that math for Richard's wife. Drug-induced cognitive decline is often reversible. When the burden is reduced under medical supervision, the fog lifts, memory returns. Helen came back. Your person can too. Action plan. 1. Write down everything you take. Prescriptions, over-the-counter, supplements, sleep aids, everything. 2. Score each one on the ACB scale. Know your total. 3. Schedule a medication review. Say exactly this: I'd like to assess my anticholinergic cognitive burden. 4. Ask for deprescribing, supervised tapering of medications carrying unacceptable risk. 5. If dismissed, seek a geriatric pharmacist. They perform comprehensive medication reviews most general practitioners never have time to do. Before you leave, I want to hear from you. Which of these 9 medications are you or someone you love currently taking? Have you noticed brain fog, memory lapses, personality changes, and never once connected them to a pill? Have you had a doctor dismiss these concerns as just getting older? Tell me in the comments. I read them, this community reads them, and sometimes simply knowing you're not alone and that what's happening isn't inevitable is the first thing that changes everything. If this video helped you today, please share it. Send it to your sister, your spouse, your neighbor, the person in your life who keeps forgetting things and can't figure out why. They are probably not going to find this on their own. You might be the reason Helen gets to sit back down at her piano. I'm Dr. Sarah Clarke. Protect your brain. Now you have the tools. See you in the next one. This video is for educational purposes only. Never stop or change any medication without consulting your physician first.